Open it. Okay, I am going to go ahead and make sure we're going to get you unmuted first there, Dr. Porter. Are you able to unmute just to make sure?
1 sec. Can you hear me?
Perfect. We are good. Okay, perfect. Technology. I am thankful today. So I'm Desiree Mamet. For those of you who don't know me or haven't seen me do other interviews with various amazing doctors here. And so I am so excited today to have a huge mentor. He's become a huge mentor to me over the last few months of getting to meet him. And so I'm so excited to have him on today, Dr. David Porter, who is the owner of Synergy Dental. And he has 2 different practices, one here in Gillette, Wyoming, which is only a couple hours away from me. So I'm very blessed. And then to have another practice in Sturgis, South Dakota. So he is a busy guy, if you can imagine, not only being a doctor and being a biological dentist like he is, but having 2 different practices is quite the deal. So I am so excited that he is able to take the time today because it's not easy with his crazy schedule. So first off, I'm going to really quickly read just a little bit about him and how he got into biological dentistry, and then we're going to kind of get into it. So if you guys have questions, make sure and put those in the comments. And that's something that Dr. Porter, we could have him help answer those questions. I can reach out to him afterwards since he is so busy and kind of ask him those questions as well and get those posted. So we are so excited. So I'm going to start off with this first. So Dr. David Porter is a native of Wyoming and graduated from the University of Nebraska in Lincoln in 2007. He has been committed to education throughout his professional career. With the support of his wonderful wife, her name is Afton, she's amazing, and he has a huge family of 6 kiddos. He has been fortunate enough to work with some of the finest healthcare practitioners in the world. Dr. Porter has an attitude that he always has more to learn and feels that everyone has something to contribute in the pursuit of health. And I love that about him, that I think so often sometimes, we see where you think you know everything in a certain area of medicine, and he is one that loves to learn. And so I love that about him. He practices biological dentistry in Gillette and Sturgis, like I said, and people travel all over the country for Dr. Porter's solution-based health approach. He is currently writing his first book, which I can't wait to read. It's hopefully going to come out kind of little later this fall, closer to the holidays. And it will outline the AIM process for the prevention of chronic disease by eliminating airway disturbances, infections, and metals in the oral cavity. The body is able to start the healing process. When Dr. Porter is not reading or studying, he loves spending time with his wife of 27 years, Afton, and their 6 children. Both David and Afton love spending time outdoors in the Black Hills of South Dakota. Right now, he's at his place by Devil's Tower, which I love that. And he is fortunate enough to be able to work with a fantastic team of healthcare professionals that include his wife, 2 of his daughters, and they're all focused on health and wellness and prevention. So first off, I just want to say welcome, Dr. Porter, to this call. I would love to start off a little bit. I think everyone, first off, this is such I think more of a shift in dentistry. We've seen a little bit of this more over the last few years. And my first introduction to biological dentistry was when I was actually in Germany for Lyme disease treatment. And I remember them really focusing on mouth health and asking me a whole long history of oral health. And I have been fortunate enough, I've never had a cavity in my life. I've never really had any dental work done, minus my wisdom teeth being pulled. So they were very excited to hear that I hadn't had multiple dental procedures. So that was my first introduction. And then over the next years, especially when my mom was diagnosed with breast cancer just a little over 2.5 years ago, that really started my love for biological dentistry and just learning how does disease correlate to the mouth. And so I want to first preface that this is not a knock on traditional dentistry. This is just giving people information about and your journey of how you got into this and what things you saw, because you were in traditional dentistry, correct, for multiple years before this. So I'm going to turn it over to you to kind of explain a little bit more about your journey with that.
Yeah, I guess my journey has just really been, I think, much like everybody else's journey that's involved in health. It's really, it typically is an evolution. You learn one thing and you become fascinated with that, and then so you quickly realize, if you're in healthcare, I think at least you should, that we certainly don't know everything. And so once you realize that, then I think that that is oftentimes the first step to progression. And so in my case specifically, like I said before, it's just really been an evolution. I got out of dental school and thought I would practice traditional dentistry for the rest of my life. And it wasn't very long into that, um, that I just kind of said, wow, is this it? Is
Mhm.
this what I'm going to be doing for the next 20 or 30 years of my career? And I just wasn't, although, I was helping people in the ways that I had been taught, it just didn't feel fulfilling. And so I said, well, I certainly don't know everything. I just graduated from school. I need to learn more things. And so I just became really on this quest for education. And I just, like, as I said, as you said in the intro there, I've just been really fortunate enough to meet some just wonderful healthcare practitioners that have open minds, that have a lot of experience. And so that just has really opened up, over a lot of years, my eyes to what is possible, and to really how, in medicine, oftentimes we get into this thought process of how everything is separated, and that's not how the body works at all. Nothing is separated. You can't isolate anything. And so you realize that all these wonderful, magnificent systems work together in conjunction with each other. And that is fascinating in of itself. And it really allows you to never stop the learning process. And so that's just kind of what has become my passion, is just continue to learn and to continue to help people. And I think it really becomes a neat process when you can implement these things into your practice, and you really have the ability to see, I don't say this word lightly at all, but really miracles in people's health transformation. And so that is somewhat addicting. You do that for somebody, and so you want to do that for everybody. You want to have that experience for everybody. And so it just pushes you to study more and read more, and inquire of other people more. And like I said, it's very fulfilling and very rewarding. And I couldn't imagine doing anything differently.
No, I love that, what you said about just that addicting to, and I find that as well, when you start to help people, I always say you can't put a price on that. No matter if you're getting paid to do it or not, it
Yes.
becomes addicting, because when you have information that can help people or change people's lives, it's really hard to not want that, or that become contagious, just wanting to be, helping people. And so I love that you said that. So real kind of, I guess, what makes biological dentistry? Because like I said, it is such a new term that we're starting to hear more over these last, like I said, 2, 3 years. We've heard more, but what makes biological dentistry, I guess, approach different than traditional dentistry?
I guess the approach is really considering the biology of people when you're doing the dentistry. I mean, traditional dentistry, and like I said, it's I've got, in whatever field you're in, or whatever your views are, I believe there's always room for progression, and certainly there is room for progression in dentistry. And so some of the materials and ways that have been taught over years, for example, mercury fillings. We
Yeah.
know that mercury is the most toxic non-radioactive substance on the planet. We know that there's no safe amount of mercury exposure. We know that it crosses the blood-brain barrier. There's all this information that we have as far as the toxicity of mercury. And so certainly at one point in time, that information really wasn't readily available. And we just didn't know. And clinicians did from a dental aspect, a really good job of using that material. But when you know better, you do better. And so biologic dentistry is really focused in on using materials that are the most biocompatible for the body. And so and when we do that, it prevents the body to kind of go into an inflammatory state. And so that's really the broad, biologic dentistry. You can define it in much more specific terms, but that's a very broad term. Is just you're trying to use materials that are biocompatible with the body, the patient's not going to have an immune response to. And that's kind of like I said, a very broad definition. The other thing that you're looking for is just you're looking for the source of the problems, right? You're looking for things when you're talking to somebody about their health or their health conditions. Your goal is to really try to find the source of the problem rather than symptom-based approach in medicine. So those are the two big differences to biologic dentistry.
No, and yeah, and I love that where you kind of talk about, when we always talk about that, even within our company too, is like getting to the root of the disease instead of kind of Band-Aid after Band-Aid after Band-Aid. And I've heard so many stories about people linking kind of their mouth back to certain things in the body. And so I remember, again, one of my first exposures was during a thermogram, when I started getting thermograms about 7 years ago. And just when they had mentioned my mouth, like looking at the mouth, looking at the gut, looking at the overall system, not just looking at what could potentially lead to or looking at a thermogram and looking at just the breasts per se for a female specifically, also for males, but looking at, the overall body to how does it drain and everything, the lymph system and everything with the breast and the gut and, the jaw, infections in the jaw. So I think it's really fascinating how do like different teeth in the body correlate to different organs in the body, if that's the right way of asking that question.
So all the systems in the body are linked one way or the other. And so a common term is called meridians. And so all organ systems are linked together. And so specific teeth are linked to specific organ systems. So by having an unhealthy tooth, whether that be potentially, a root canal treated tooth or an infected tooth or a cavitation or even a cavity to some degree, that has an impact on that organ system, that chain of organs that's connected to that tooth. Now that may cause problems down the chain. It may not. It depends on obviously a number of different factors as far as the person's overall health and a number of different things. But teeth have a direct impact on the person's overall health and on the person's overall other organs. And we've witnessed this. I mean, it's kind of we don't probably get nearly as excited as we used to on some of these things just because we see it on a routine basis. We certainly try to recognize on certainly a weekly basis of the changes for better that we've had an impact on in somebody's health. But the teeth that we kind of view as kind of a almost a side note in dentistry have a direct impact on one's health and vice versa. The organs in the body have a direct impact on the teeth. And so the system just does not flow one way from teeth down to organs. It flows back the opposite way as well. And so when we're looking at somebody's health and we're looking at helping somebody get well, it's important that we understand that and that we have an appreciation for that so we can ultimately try to get to the root cause of problems for people.
So when you talk about that, because I know for me, and I love, so Dr. Porter came here to Casper kind of last spring time and did kind of a talk about health and biological dentistry. And I loved how you explained the gut part of it. And I think that's a huge thing that we are always talking about, how the gut is the immune system. I mean, 70 to 80% of your immune system is in your gut. So I remember, like I said, I go back to my mom a lot and that diagnosis, because when we went to an integrative cancer treatment facility in Scottsdale, they also talked about the mouth a lot. And before we went there to the facility, and I'm not saying that a root canal causes breast cancer. What I say is when they looked at her thermogram, all the inflammation was in her mouth and she had 2 very infected root canals. So when you look at kind of all this correlation of the immune system, and so when you look at like a root canal, and I know that I've learned, and even in Germany, they said this, that all root canals are infected. You can't feel that. You don't feel that infection, just like my mom didn't feel anything in her mouth. But before they treated her, they said, we need to start working on some of these dental things because we can be doing all of these other things. But if your body is constantly fighting that infection, that's, your good army is going to that, and they can't really get to that. So can you explain that, how you don't necessarily feel that, but what is that infection potentially doing to the lymphatic system, but also how does that directly affect the gut?
Yeah. So yeah, that you're exactly right there. So I always kind of tell the story of, I think it's a kind of an easy illustration for most people to understand, of like, if you're out camping in the middle of the forest and you eat this big nice campfire meal and go out on this nature walk to enjoy the beauty of nature, and you cross paths with a grizzly bear, okay, your autonomic nervous system is going to be activated. Okay, so your autonomic nervous system, for simplistic terms, is mostly kind of 2 parts: your sympathetic nervous system, which is fight or flight, and your parasympathetic nervous system, which is rest, digest, and heal. And we only can be in one or the other. Okay, we can't be in both at the same time. So as you're going on this nature walk and you cross the paths with a grizzly bear, your sympathetic nervous system is going to be activated. Okay, and so when your sympathetic nervous system is activated, all the resources of the body are going to be diverted towards your muscles and brain so that you can run, kick, scream, climb, fight, do whatever you need to do to escape from the bear. If the bear catches you, okay, it's going to get a meal and a dessert. Okay. You as the meal and the contents of your stomach as the dessert, because when your sympathetic nervous system is activated, digestion stops. Okay. And that's a self-defense mechanism, right? Obviously, if you're running away from the bear, you want 100% of your energy focused on getting away from the bear. Well, when you have an infection in the body, or you're dealing with outside things inside the body, the sympathetic nervous system is what responds to that as well. And so the body doesn't really distinguish the difference that much between a dental infection or a grizzly bear. It just knows inherently that, one, if the bear catches you, it's most likely going to kill you. And 2, if the infection gets out of control in the body, it will do the same thing. So the autonomic nervous system, in its intelligent design, knows that and diverts resources to making sure that the infection is kept at bay. Now, dental infections, like many infections, but specifically dental infections, oftentimes do not cause any pain until they are just wildly out of control. The body's got a self-defense mechanism that ideally is trying to wall and isolate that infection off, because again, the body knows the infection has a capability of killing anybody. So it diverts the resources to the infection, keeping it at bay. But the problem with that, over a long period of time, certainly short period of time, your body can adjust and compensate for that very easily. But over the long period of time, if your digestive system is not working correctly, okay, the whole purpose of our digestive system, the whole purposes of us eating food is very singular in focus. It's for the purpose of to make new cells to replace the old cells in the body. So that process is happening 24 hours a day, 7 days a week. We have about 80 to 100 trillion cells in the body, depending on where you get your information from. But every single one of those cells is replaced with a new cell every single year. Your brain and your liver and your heart and your organs are typically replaced on average about once a year. Okay. Other cells are replaced a number of times within a given month. But the fact is that every cell is at least replaced at a minimum of one time throughout the year. So your body's in this constant state of renewal, right? And if your digestive system is being ignored for whatever the reason is, okay, we're in sympathetic all the time, our bear's chasing us all the time, we're dealing with infections all the time, the digestive system is not going to work to its optimal potential. Will it be at 50% capacity or 40% capacity or 30? We don't know that number. That's going to be based off of the individual. But if we're running a deficit every single day and every single year, at some point in time, we don't create enough new cells to replace the other cells. And then we develop a chronic disease. We develop a cancer or liver failure, or kidney failure, or whatever the case may be, but our body's certainly not healthy. And that is the process that always leads down to chronic disease.
Yeah, and I love that you kind of constantly go back that it's the whole system. It's not just, I always tell people when we look at like cancer or Lyme disease or autoimmune, it's not one thing that's affected, it's multiple parts of the system that are not working. So you can't just focus on where is the problem area or the pain, because I always hear that pain is the last symptom. That is a very delayed symptom, but that doesn't mean, like you said, in your mouth that you can't necessarily feel these things. And so that was unique. I know, like with my mom too, she's like, well, I didn't feel it. And then when she saw what came out of there, it was just fascinating. So what things, and not making claims, and I know we're big on this, like I'm not claiming that by taking out a root canal, or for me, what I did have Dr. Porter do just this past end of January, where I had my wisdom teeth taken out. He did take a look and saw where that bone density was different. And like what he said, that means that there's infection there. And so 2 of those, he went in, and you can explain kind of what you do with that, but what things have you seen, I guess, when you've done dental procedures with people that has changed in their health? Or what things, and I know that you said that,
How much time do we have?
what's that?
I said, how much time do we have?
I know.
Yeah, I can
And
certainly
some
think
things
of,
that,
go ahead.
no, I was just saying some things that, are an interesting correlation to
Yeah.
when, and I know you told some really neat stories. So we would love to just see what are some things potentially that someone dealing with chronic disease, or, just trying to prevent from getting chronic disease, what things might they feel or have you seen?
Yeah. Well, like I said, I would never claim that to a patient or a person in general that, okay, if we do this, you're going to get this result, because the system is just, it's more complicated than that. And so I would never make that claim to anybody at all. But what we've seen is like I said, I certainly do have lots of stories, certainly some favorite ones that I think of is that, so we had a lady in from Rapid City, and most of this, the kind of the funny thing is that I find out about most of these things well after everything is done. Okay. And
Sure.
so, because people oftentimes they just don't correlate the, certain things to their dental health.
Yeah.
And so again, I'm finding this out after the fact, but this wonderful lady, her name is Sarah. She came in and she had a root canal tooth on an anterior tooth right here in the front. And obviously that's kind of a big deal for really anybody to kind of deal with, or the thought process of potentially losing that tooth. Well, like all root canals are, the tooth was infected, and we could visibly see it on the x-ray. And so we went over her options as far as what could be done. She elected to have the tooth removed, and we replaced it with a ceramic implant. And she comes in, a few months later to test, to get the implant checked and stability test and all those different things. And she informs us that for the last 5 years that they've been able to have another child. They have 3 already, but they haven't been able to conceive, and they really don't know why. Nobody really can give them an explanation. They were thinking about starting to use like fertility, some means to try to accomplish their goal of having another child. Well, within 2 weeks of have that tooth being removed, she was pregnant. And
So amazing.
so if you really look at, if you look and understand the meridians, well, this anterior tooth here sets on the ovary meridian. And
Crazy.
so, she said that on her way home, she could immediately tell just a difference in her skin. Okay,
So
which, your
crazy.
obviously your gut health is a direct correlation to your skin health for sure. It's really, your gut health is really a direct correlation to everything in your body. But so obviously that was, a really just neat thing, and we've seen that happen a number of times, in women who have had trouble conceiving or haven't been able to get pregnant or maintain a pregnancy, where we removed infected teeth, and they all of a sudden they just get pregnant. We
So crazy.
Yeah,
So
we
cool.
had a yeah, no, it really is, and we had a gentleman, that came, from the eastern side of South Dakota to see us, and he had a couple just infected teeth, and we removed them, and then, oh, a couple months later, he was able to come back, and he informed me that, he's, in his early 70s, and he said that he had had the first normal bowel movement since he was
Mhm.
15 years old.
Oh my goodness.
Yeah, and so he was just obviously, those are little, obviously those are big things, but those are things obviously that a lot of people take for granted. And
Yes.
your bowel movements are obviously directly correlated to your health. And so, obviously that was really neat. We saw another lady that that was just, much like Des, very healthy, very thin, very fit, exercised, and she came in and again had an infected tooth. And I went over everything with her, and she admitted to me later that she kind of said, well, every doctor believes that what they do is kind of the end all to everything. And so I really kind of didn't believe in some of the things you were saying, but I could certainly see on the X-ray there that there was a problem. So I said, it's time for me to do something about that. And so we removed the tooth and we placed a ceramic implant in, and a few months later she comes in and she's all, "Well, I just really wanted to share with you that that I've been suffering from really chronic inflammatory response in my gut. I've been
Mm.
to Mayo Clinic, I've been to the Cleveland Clinic." She's all, "I've tried every diet known to man, the Mediterranean, the keto, the paleo, the carnivore, everything." She's all, "Within 2 weeks of the tooth being removed, every single one of my symptoms was gone."
That's incredible.
And
It's
she said that,
incredible.
"I would, if you would have told me that you could have fixed my gut issues, she's all, I would have written you out of check 10 times the amount that I did
Yep.
for no service, but just to get rid of my problems that I had."
It's
Um,
amazing.
and then her mother came in, oh, I think it was just a couple months ago, and she was telling me, like, "I just wanted to let you know how grateful I am for, what you've done for her." She's just a tiny little thing, and she may weigh I don't know, 100 pounds soaking wet. And she said for the first time in well over a decade, probably longer, she's been able to actually put on weight.
Love that.
Yeah. And
And
so,
that's
and
a
keep
huge
it on,
deal. And
and be healthy.
yeah, and we always say that your weight is directly, like, if you have a problems losing weight or gaining weight, they are both directly linked to that gut. And I see that a lot with people as you start to heal their gut. They're like, oh my gosh, I was able to gain a few pounds, or I was able to lose a few pounds, and I've tried everything. But if that gut is not in balance, your weight, you just won't always be at a healthy weight then. And so
Yeah.
those stories are incredible. And I think that's, when we look at, and I know for you, when we talk about like inflammation and how we kind of got connected, obviously through biological dentistry. And then we talk about, oxidative stress and how protandem nerve 2. And I love that you were so knowledgeable about oxidative stress. So oxidative stress, I know, directly links back as well with a lot of dental infections. And you look at periodontal disease. So what are your thoughts on, so with oxidative stress, when someone is dealing with an infected tooth or periodontal disease, is that link Is it because of the high amount of inflammation that that's causing, or how does that all correlate back, or how does oxidative stress play a part in all of that as well?
Well, oxidative stress is a normal thing in body, just like inflammation and oxidative stress are obviously different. Inflammation is normal in the body. Inflammation is a repair process that the body goes through. Okay, so if you hit your hand with a hammer, okay, it's going to swell. Okay, that's inflammation. Oxidative stress is a really interesting concept because you really get into what's called energy medicine. Okay, so oxidative stress is really the loss of electrons in the body. When a molecule loses an electron, okay, it becomes a what's called a free radical. Okay, well, free radicals cause a tremendous amount of damage inside the body. Now, again, to some level, that's a normal biologic process, but just like with anything, if it gets out of hand, that's when disease sets in. And so oxidative stress, as I said before, this is when you lose an electron. Okay, we want antioxidants to be able to kind of help the body restore, to keep the oxidative stress within certain parameters, a healthy parameter. And so those are all things that happen because of again, disease, or those are the true things that are causing disease in the body. And so when we think about oxidation, the first thing that I think of is kind of like the body has got things where energy's coming in, and there's things where energy's going out. Well, one of the primary drivers of energy being lost to the body is dental infections. That's really number one on the list. Okay.
Oh,
Other things that cause that are, thyroid problems, toxins in the body, obviously, is a big driver, especially in today's society. Okay, emotions is a really big thing as well too, and scars. All these things cause oxidative stress or loss of electrons inside the body, which again ultimately leads to, if it's left unchecked, chronic disease. A really neat thing that I've read is I believe it's with and you can correct me if I'm wrong here. So glutathione is a antioxidant, and it's one that's not very it's something that's made within the body. It's not very well absorbed by the body. So if you just take a supplement glutathione, well, a lot of people really have digestive problems in there because the body doesn't really absorb glutathione very well. So the
yep.
best place to have that made is within the body. So from what I've read, I think that NRF1 increases glutathione production. It was like 300%, I believe.
Yeah, the
So
NRF2,
Oh,
yes,
NRF2. Okay, yeah,
yes,
my
yes.
mistake there. So yeah,
No,
increases glutathione production 300%. And so that is a huge deal when it comes to your health. I mean, again, oxidative process is a normal process in the body, but it has to stay in check. And so by having a supplement that helps your body produce that naturally on its own, you're not worrying about, is the body absorbing it, is a supplement I'm taking worth the money that I'm spending, because is anything good happening due to it. Again, if the body doesn't absorb it well, for whatever the reason is, it doesn't matter what you're taking, whether it's a vitamin D supplement, or whether it's a glutathione supplement, or whether it's a vitamin C supplement. If the body doesn't absorb it, it's not doing any good. So
yeah,
again, I just go back to the thing of, our goal is to get the body to function optimally. There are some supplements that are really good to take. I tend not to try to go overboard because people can become overwhelmed in, taking
yes,
just, hundreds of supplements on a daily
yes,
basis. The goal is to try to limit it to as few as we can, but all with the purpose of making the body function exactly how it's supposed to.
yeah,
And the reason why I really, at least in my view of why today really supplementation is very beneficial and really needed for optimal health, goes all the way back to our food supply. And really that's where a lot of the things that have gone wrong from a healthcare perspective started, is in our food supply. The soils that our food are being made from are not the same as they were 50 and certainly not 100 years ago. I mean,
yeah,
the United States USDA did a 100-year study from 1914 to 2014, showing that the food that we eat today compared with 1914 is 89% deficient in vitamins and minerals.
Wow,
89%.
that's crazy.
So when you think
Crazy.
89%, you wonder of like, well, why aren't we even sicker than we are? I mean, is really the question that I
Yeah,
have. I mean, it's amazing. The human body really is amazing, but
yeah.
if you're able to give the body really what it needs to function correctly, then I mean, miracles really are possible.
No, absolutely. And I know we could talk all day long on, that part for sure. And, you're right in that we're so lucky to have, doctors like you who are looking at the body as a whole and having supplements and the right things that can help our body work the way God intended them, even though there's been these
Right.
obstacles and things put in front of them. So no, I totally agree with you with that. And I love your mission and just to help people. And I think I could probably talk for hours with you and interview you, but kind of in closing a little bit, how does somebody even go about if they wanted to come, see you, and we'll put your information about your practice and stuff. How I know for me, it was really neat and it was fascinating because that first appointment, I spent a few hours there. It was not a traditional dental appointment. I did have a cleaning, things like that, but it was getting different x-rays, but it was also looking at vitamin D and it was looking at different acidities and, different things in the gut and all of that. So in that, for how do people go about, I guess, or what do you recommend if someone was saying, I just want to come get this baseline, I just want to come check you out, see what you're about, your practice, how would they go about doing that? Or what do you recommend?
Well, certainly the first step is just giving one of our offices a call, whether that be in Gillette or Sturgis, and certainly one of the receptionists there can certainly help you. That initial visit, as Des said, is a longer visit, and it's certainly longer with purpose. We're trying to get a baseline on somebody's overall health, and so that's really the goal. I study that information. I look through the radiographs, from the three-dimensional radiographs, the two-dimensional radiographs. I look at the health scores that were assessed. I look at the patient's, health history, and so I really study those really for each individual, hours. And I go over all that information, and then we schedule a time for a consultation with that person, and then I just sit there with the patient, and we just go over, I say from everything from A to Z in regards to their health. Obviously, our focus is on their dental health, so my job there is to educate them on where their dental health is, and then what their dental health is doing to their systemic or overall health, and how those things are integrated and how those things are intimately linked to each other. You can't have poor dental health and have good health.
Mm,
That's impossible. And vice versa, right? If you're not healthy systemically, your oral health is not going to be good too. We have to be careful about isolating systems in the body, because there's no
yes.
system again that is isolated in the body. And so everything is connected. And so that's my job during that consultation, is to make that connection with the person, inform them of what their health is, and then again, let them make the decision on what route is going to work best for them. I really try to pride myself on, again, just doing the best I can to educating people. Everybody is at a different place in time in their health journey. And so it's not my job to judge or to, look down upon somebody for a decision that they've made certainly in the past or going to make in the future. My only responsibility is to make sure the patient leaves my office with all the information that they need to move forward in whatever manner is going to suit them best.
That's why we love you and we're so grateful for you. And I just appreciate your time and everyone's time for listening in. And I know we could talk for hours with you, and I can't wait to read your book. And we'll put the numbers for his practices here in the comments and everything. And just if there's other questions that people are taking, the recording of this, looking at this, let us know and tag me on that, and I can send those off to Dr. Porter and we can get those answered as well. So just thank you tons for all of this, and Michelle for helping with technology. And like I said, Dr. Porter, taking time off your day off here. And if you have anything last you want to say?
Well, I just want to obviously say thank you to Des and Michelle for, hosting this. My mission is to help people. And so I think the first step in doing it, all that, is give people information. And so if I can hop on a Zoom call, or if I can drive down to Casper or go someplace and just inform people and give people the information that I think that they deserve and that they need, then I'm always happy to do that. And so I really appreciate you girls taking the time out today out of your busy schedules and your time to do this for people. I ultimately believe that you guys are certainly a part of the solution. And I really appreciate and admire your commitment to health and helping people around you. That means a lot to me, because that's what I strive for every day as well.
Well, thank you. That's so sweet of you. So thank you so much. And thanks for everybody listening in, and thanks, Michelle. And so I hope everyone has a wonderful day, and here's to good health, right?
Absolutely. Good health.
See you guys.
Thank you, Dr. Porter.
Thank you very much.
Oh, so blessed, so grateful. All right.
If I can be of any help or anything, please don't hesitate to just reach out. I'm happy to answer any questions, or, like I said, anything that I can do to help somebody out. I'm happy to do it.
Thank you tons.
Thank you.
Have a blessed day.
Great. Thank you. You too.